In this video, we're going to be diving into a question that I get asked every week by my patients suffering from neck or low back pain, and that is, can herniated or bulging discs heal on their own without surgery? Hi, my name is Dr. Frank Altenrath, and I'm a corrective care chiropractor in Cresskill, New Jersey. In this video, we're going to break down what a herniated disc is, the symptoms that you might experience, and the natural healing process your body can go through. And most importantly, we're going to answer the question of whether a herniated or bulging disc can heal on its own without surgery. We'll also discuss when a herniated or bulging disc requires immediate medical intervention. So if you're dealing with a herniated or bulging disc, or you're just curious about spinal health, stick around. Let's get started. So to begin with, many bulging or herniated discs cause no pain at all. Studies have shown, as a matter of fact, that 25 to 40% of people have asymptomatic discs when seen on MRI, which means there's no pain whatsoever. So let's go over how these herniations occur with this video animation.
So let's take a look at the anatomy of a disc bulge or herniation. On the screen are two pictures of a spine, one from the side view and one from the top looking down. On the side view or lateral view, we see, I'll use my pointer here, we see two vertebrae, one on the top, one on the bottom, and we see a disc in between. And the disc is cut away so you can see inside what's called the nucleus pulposus, or what's commonly referred to as the jelly of a disc. And then the outer material is the annulus fibrosus that holds in the jelly in place. Now in this top-down view, an axial view, we can see the annulus fibrosus, again, which encompasses or circles the disc, is the boundary for the disc, and then the nucleus in the middle, which is a jelly-like, crab-like meat substance. Now a healthy disc has high water content, which allows the disc to be a shock absorber for the loads on the spine. And this disc will then disperse the forces peripherally, evenly throughout the disc itself. With a disc injury, whether it's a herniation or a bulge or a sequestration where part of the disc breaks off and floats around, what usually happens, unless it's an acute case, but what usually happens is the outer layers of the annulus fibrosus, which you see here on the right, start to develop cracks, tiny cracks in the outer ring, or in the ring of the annulus fibrosus. Here you see it on this view, and on the side view you see it here in the back, posteriorly. Those cracks create a pathway, a channel for the nucleus pulposus, which is the jelly in the middle, to then start to migrate through and start to get close to the spinal cord, nerve roots, or the thecal sac, which envelops the spinal cord. You can see on this side here on the left, it starts to bulge out. Now this would be a central disc bulge herniation, in this case because the nucleus is bulging into the middle or the central canal, spinal cord canal right here, and here we see it on the side view. Now in this video we're going to see a lateral disc bulge herniation. We see here on the right hand side the cracks are forming in the annulus fibrosus on the lateral aspect of the disc, creating the pathway for the jelly to migrate onto that nerve root, and once it touches the nerve root, the person will experience pain wherever that nerve goes, whether it's in the butt, down the leg, right side or left side, all the way to the feet. And here we see it on the side as well.
So to summarize, the outer ring of the disc is called the annulus fibrosus. Now this annulus contains the nucleus or the gel-like material in the middle of the disc, sometimes referred to as the jelly. And this jelly, this nucleus, acts as a shock absorber and a force dissipator. Now the annulus, the outer ring of the disc, is made up of cross-linked woven fibers that hold the center jelly in place. Now the outer annular fibers can break and form little cracks. This can happen from injuries, lack of spinal motion, the aging process, and when they do, the jelly material on the inside can start to creep out. Now, the nucleus has chemicals in it that irritate the nerves and surrounding tissue, and it's called chemical irritation. It also has mass that irritates the surrounding tissues, including the nerves, which cause pain from the pressure of that bulge, the disc jelly material, touching on the surrounding tissues, pressing on the nerves and tissues. Now, all these things can bring about the familiar symptoms that we think of and we associate with having a disc bulge or herniation, such as pain, numbness, tingling, muscle weakness. So how does the body heal? Well, foreign substances in the body and a disc bulge or disc material in places that it shouldn't be is considered a foreign substance by the body. Well, in this case, the body activates specialized cells called macrophages and monocytes. And these cells act like little Pac-Men, chewing up this foreign disc material and removing it. The body will also heal the outer annular tears by creating scar tissue. But keep in mind that scar tissue is weaker and less elastic than normal tissue, so it's going to be more prone to injuries in the future. Now, what's interesting is that it seems that the larger the disc bulge or herniation, the faster the body can heal it. This is due to the large water content of disc material, and then the water, as it dehydrates, will shrink the size of that disc bulge, which will then reduce the pressure on the nerve as the disc bulge gets smaller, taking pressure off of the nerves and tissue. The remaining disc material that's left will be removed in time by the specialized cells I mentioned before, the macrophages and monocytes. So when should you seek medical attention? Well, if you have severe pain or neurological symptoms like loss of muscle strength, you should speak to your doctor, your primary care physician. If you have loss of bowel or bladder control, or bladder or numbness around the anal region, which is called saddle paresthesia or cauda-equina syndrome, you need to go to the emergency room immediately, which in that case they would do a decompression surgery. But fortunately, that is a very rare happening in things like disc bulges. So in summary, if you can tolerate the pain of an inflamed bulging disc or herniated disc, and you can be patient, most disc injuries will go away over time. In fact, greater than 90% of the pain of disc bulge and herniations will get better in 6 to 8 weeks. If you enjoyed the video and you got something out of it, hit the like button, tap the notification bell so you keep up to date on our new released videos, and consider subscribing to our channel. And if you know anyone that's suffering from a herniated or bulging disc that could use information like this, feel free to pass it on to them. And until our next video, thanks for watching.